I think it's fair to say nobody really wants to talk about bunions, but a lot of people have them, and they are not fun. If you've been holding off having them removed because you're afraid it's going to be painful, it may finally be time to take action.
Health editor Dr. Maria Simbra explains how a new treatment for bunions is getting people back on their feet immediately.
Through the years, with all the activities that I was doing, it seemed to progressively get worse.
Something was wrong with Ann Oxley's foot.
It got to the point where I was very limited on the shoes I could wear. My main concern was not being able to keep up with my kids and hikes and walks, as well as just going, to and from their sports activities. I definitely had a bump. I thought it was a large bump, and it did come along with the pain and the discomfort.
Most of the time our patients will complain of pain. My average patient is 45 years old. They're working, they have children, they have events to go to.
People who get bunions are born with the tendency.
Most people think that shoes cause bunions. They don't, but they may make it come on faster.
I changed shoes, I modified my activities, I quit running.
If low-heeled, comfortable shoes aren't helping and the pain interferes with daily activities, surgery is an option.
If you want to be a runner, I got to find a way to make you into a runner. If you want to wear fashionable shoes, I got to find a way to help you wear fashionable shoes.
Most people see a bump near the big toe on the inside of the foot and identify this as the bunion, but actually the problem is at a joint higher up in the foot.
One approach is to shave down the bony prominence, but that doesn't correct the issue.
Just hiding the bump has led to the recurrence or the bump coming back. And the reason why it comes back is that joint that started it all was never addressed.
This orthopedic surgeon at West Virginia University with colleagues from around the country developed a new technique called Lapiplasty. It realigns the bones at the problematic joint. During the surgery, the doctor makes an incision on the top of the foot and takes out the cartilage at the involved joint. Jigs and clamps hold the bones in realignment. The bones are then fixed into position with titanium plates and screws. They are flat and flexible.
They're meant to move with weight bearing.
Patients can bear weight immediately after the procedure.
It is an outpatient surgery. You only here the afternoon or morning and you're gone. Most people go back to work about 2 weeks after surgery. They say they can't wait for the other side so they can get a pair of shoes that match now.
After surgery, incision care, swelling control, and watching for recurrence or the bones not healing are important. In the 4 years since doctors started performing this surgery, the number of complications have been small, occurring in about 1% of patients.
We will pass 10,000 surgeries in our history this summer.
In the United States, 150,000 bunion surgeries are done a year. You cannot have Lapiplasty if you have a nerve problem called neuropathy or severe arthritis of the big toe. Anne had her procedure in December. She was thrilled she didn't have to be in a cast for 3 months.
I was glad that I would be able to just be in a boot for 6 weeks, but to actually have a surgery where they fixed a bone and to be able to walk out on it on the same day was pretty amazing.
The general advice is no running or jumping for 4 months. But just 3 months after surgery, Anne was back to normal.
Probably at the gym about 4 times a week. I'm keeping up with the kids. I'm up and down steps. I can cook. My husband and I went to the Masters. I was able to stand and walk around for 6 hours, so I have not been limited in any of my activities. And the bump is gone.
I'm Dr. Maria Simbra, KDKA News.